Families in Delaware County will soon have one less option to deliver their babies. OhioHealth announced today it will close the maternity unit at Grady Memorial Hospital at the end of July, citing declining use of the service. But employees, patients, and healthcare advocates warn the decision could leave expecting mothers traveling farther for care in one of Ohio's fastest growing counties. 10 TV's Libby Cathy spoke to some of those affected and joins us tonight live in studio. Libby.
That's right, Jeff. I spoke to 3 staff members losing their jobs and a patient impacted. Now, they all declined to go on camera out of fear of retaliation, but all say they were blindsided by this decision and now fear it will hurt the community.
Now we have an entire county in the state of Ohio that has no labor and delivery unit.
There's still time to save that maternity unit.
A fight to save a maternity ward just beginning after OhioHealth announced Wednesday it will end maternity unit services at Grady Memorial Hospital at the end of July.
This is really leaving a lot of Delaware families in the lurch.
Announcing the closure, OhioHealth says fewer than 10% of Delaware County families who delivered within the OhioHealth system chose Grady last year, and that more families are already choosing Dublin Methodist and Riverside hospitals. The closure will eliminate jobs for 37 employees. Leadership saying in a statement, our priority is making sure every mother and newborn has access to the level of care they deserve, including around-the-clock obstetric support and advanced newborn resources that most community hospitals are not equipped to provide. Delaware City Council member Lindsay Griffith calling the move both a shock and disappointment.
This is going to put a huge strain on our lowest resource residents, and it does create a maternity care desert for our city. And I think that that's a tragedy. And so we need to fix this for our county.
The Ohio Nurses Association also warning the closure could force expecting mothers to travel further for care and add pressure to already busy hospitals.
That could mean death and lifelong disability for a newborn. It could mean the death or injury of the mother that is needing emergent care. And then there are folks that, it's a hardship, they can't afford to travel.
Lucas says the union plans to rally nurses and push elected officials to get involved to keep the unit open.
Because this is wrong all the way around, and our patients deserve better and our communities deserve better.
OhioHealth maintains the change will not impact prenatal, postnatal, or gynecological care in Delaware County and says Grady's emergency department will remain prepared to handle emergency deliveries. They also say employees are being offered opportunities to apply for other positions within OhioHealth or receive severance based on their years of service. Jeff?